Hey, this is Ryan Guill, and this is my bone video. First, we're starting off with the clavicle. This is the left clavicle, and this is the medial side, and this is the lateral side. This is a left scapula, starting at the bottom. This is the inferior angle, the lateral border, medial border, subscapular fossa, the superior border, the superior angle, the subscapular notch, the coracoid process, the acromion, the glenoid cavity. This is the infrascapular fossa, suprascapular fossa, and the spine. This is the humerus. This is the head, the anatomical neck, the surgical neck, the greater tubercle, the lesser tubercle, the intertubercular groove. This is the deltoid tuberosity, and then going down to the bottom, this is the capitulum, this is the trochlea, the medial epicondyle, lateral epicondyle, and then we go back here to the olecranon fossa, the coronoid fossa, and the radial fossa. This is the ulna, starting from top to bottom. This is the olecranon process. This is the radial notch. This is the coronoid process. This is the trochlear notch. This is the head of the ulna, and this is the styloid process of the ulna. This is the radius, starting from top to bottom. This is the head of the radius, the neck, the radial tuberosity, and the styloid process of the radius. This is the hand, starting from the bottom. This is the scapoid, lunate, pisiform, triquetrum. Then we move over across the top is the hamate, capitate, the trapezoid, and the trapezium. Then we move up to the metacarpals. This is metacarpal 1, metacarpal 2, metacarpal 3, metacarpal 4, and metacarpal 5. And then we have the phalanges. This is the proximal and distal phalanges of metacarpal 1. This is the proximal, middle, and distal phalanges of metacarpal 2. This is the proximal, middle, distal phalanges of metacarpal 3. This is the proximal, middle, distal phalanges of metacarpal 4. This is the proximal, middle, distal phalanges of metacarpal 5. Of the pelvis, starting at the top, this is the iliac crest. This is the iliac fossa. This is the anterior superior iliac spine, the anterior inferior iliac spine, the posterior superior iliac spine, and the posterior inferior iliac spine, plus the greater sciatic notch. And lastly, the acetabulum. This is the ischium of the pelvis. This is the ischial spine, the lesser sciatic notch, the ischial tuberosity, and the ischial ramus. The pelvis, this is the superior ramus. This is the inferior ramus. This is the obturator foramen, and this is the pubic symphysis. This is the femur. This is the head, the neck, the intertrochanteric line, the intertrochanteric crest, the greater trochanter, lesser trochanter, linea aspera, medial condyle, lateral epicondyle, medial epicondyle, and the patellar surface. This is the patella, this is the apex, and this is the base. If you lay it on the table and it goes to the right, then it goes to the right leg. This is the tibia. This is the medial condyle. This is the lateral condyle. This is the tibial tuberosity. This is the anterior border, and this is the medial malleolus. This is the fibula. This is the head of the fibula. This is the neck. This is the shaft, and this is the lateral malleolus. This is the calcaneus, the talus, the navicular, the cuboid, the lateral cuneiform, intermediate cuneiform, medial cuneiform, and this is metatarsal 1, metatarsal 2, metatarsal 3, metatarsal 4, metatarsal 5, and this is the head and the base of metatarsal 1, the head and base of metatarsal 2, the head and base of metatarsal 3, the head and base of metatarsal 4, and the head and base of metatarsal 5. And this is the proximal and distal phalanx of the metatarsal 1, the proximal, middle, and distal phalanx of metatarsal 2, the proximal, middle, and distal phalanx of metatarsal 3, the proximal, middle, and distal phalanx of metatarsal number 4, the proximal, middle, and distal phalanx of metatarsal number 5.